Well, good morning, friends, and welcome back to the ranch. I'm Dr. Lee, and it is, as you can well see, another beautiful day in South Texas. Although it's terribly windy, I tried to come out to make this video several times yesterday, but it was so windy all day, I knew the audio quality would just be terrible. So I got up early this morning and came out here just to see if we could beat the winds. And we didn't. They howled all night long. So I put the dead cat on the microphone up here. Dead cat, a term we veterinarians don't like to use much, but there's no other thing that describes it. So I hope it cuts down a little bit of the wind noise. But anyway, with no further ado, we'll go ahead and get into this video. As you can see behind me, this is the front yard that I mowed last week in an effort to cut down all the growths of grasses that came up through the really wet year we had last year and had died, leaving nothing for the ruminants to graze on. And our white-tailed deer, who all the does are heavily pregnant right now, started looking really bad. So I came out here, shredded this pasture, and just to get all the dead growth off in hopes that it would green up a little bit, and lo and behold it did. I'll show you. I'll see if I can pan this thing so you can kind of get a good look, but we really did get a nice green growth. I was out here last night pretty late, and there were deer all over this pasture, and they were enjoying the fruits of my labor. So and the proof is in the pudding. They're all looking a whole lot better too. Let me see if I've got this thing set right, and we'll finish this stupid video today. But anyway, the white-tailed deer are looking a whole lot better. They're putting on weight with their pregnancies, which is very important. And if you'll remember, a lot of them had an incomplete shed, and that's just from poor nutrition. So our plan paid off. The deer are looking better. So on with the video. And friends, this video today is going to be a little bit strange. And my goodness, how many times have I said that when I started out a video? But next week I will be retiring my veterinary license, and you know, that's kind of a hard emotional thing to do. I've always tried to be a person that did not let his job define him. I've always tried to be me first, not a veterinarian first. And but still, it's an emotional thing. It was so hard to get that degree. I struggled for 8 years to get that degree, and it was hard to maintain it. You know, I had to go to continuing education and pay fees and all that kind of stuff. So it's going to be kind of hard to let it go. It's been on an inactive basis since I retired a few years ago, but I'm going to go ahead and completely retire it, meaning I can't get it back. So that's kind of scary, but you know, it's just another milestone in life. And just reflecting back on all of that, it just kind of made me want to make one more video about veterinary medicine, especially the way it used to be compared to the way it is now. I know a lot of you folks are animal people just like me. I know a lot of you came here from Vet Ranch. I know a lot of y'all started out with me back when I was a practicing veterinarian and would always put dogs and cats and crazy cases on here. So I figured with most of you folks being animal lovers, you would probably enjoy a video about this too. Going back in times now, my wife and I headed to Texas A&M in 1980, where I transferred from one university to Texas A&M there in College Station in an effort to get in vet school. And I was very fortunate. I got in on my first application. And vet school was a whole lot different then than it is now. The student body was made up of mostly a bunch of cowboys like myself, and then a few little females scattered here and there. Basically, it was in a transition period, but from the 70s, it went from almost predominantly a male profession, where now it's predominantly a female profession. But my class in vet school was predominantly men, and the women that were there were basically setting the pace, breaking the ice for future generation of ladies to come. But anyway, I met a whole bunch of people, made a bunch of lifelong friends that I still enjoy. But starting out vet school in 1980s, technology was just beginning to get a grip on veterinary medicine. We basically felt that the future was here, and we were the first recipients of all this new cutting-edge technology. We were the first ones to experience firsthand a lot of the impressive technological changes, like watching surgeries firsthand, sitting there with TVs in the room, watching surgeons in other rooms from start to finish. We also had sophisticated gas anesthetic machines, and we also had solid-state electrocautery. In our minds, gone were the days of guesswork veterinary medicine and fire engine medicine. Gone were the days where you flew by the seat of your pants. Gone were the days of liniments and balms and camphor and sulfur oils and just being a glorified cowboy. We were scientists, and we knew it. We had studied and mapped out and memorized every bone, every artery, every vein, every nerve, every cranial nerve in multiple species. We knew it all. So after 8 years of college, I grabbed up my Lippmann stethoscope, my Welch-Allen combination otoscope and ophthalmoscope. I got my full set of surgery tools. I got my trusty thermometer. I got this. You probably know what that is. For those of you who don't, it's called a fecal loop. You might want to Google it. It winds up in some strange places. And with all this equipment and all this knowledge, I set out to make my family's future. But today, the profession is much different than it used to be. Today, it's becoming a ladies' profession. I think Allie's graduating class about 3 years ago had 80% women and 20% men. And another thing that has changed greatly in veterinary medicine is most of my classmates and I graduated with either zero debt or very, very small debts, as compared to the veterinarians of today, where $200,000 of school debt upon graduation is not uncommon. And these can be very crippling debts when you consider the starting salaries at which most veterinarians start. And another big change in veterinary medicine today is, instead of learning from confusing diagrams, charts, and textbooks, veterinarians today have phone apps that will do everything from calculating dosages all the way to recommending poison control therapies. We went from studying giant and tiny skeletons of all species to computerized programs that strip off the layers of tissues of any animal you select at the click of a mouse. We went from blood work taking 10 days from the day you pull the blood until the day you got the results to in-house computerized blood machines that have all your results in less than 30 minutes. And other changes in veterinary medicine include having to treat everything that came in the door yourself. You had to be a soft tissue surgeon, you had to be a bone surgeon, you had to be a gastroenterologist, you had to be a dentist, you had to be an obstetrician. Whereas, as many of you know today, if you go into a veterinary hospital and your dog has a broken leg, more than likely you're going to get sent to a specialist many miles away, and your vet bill is going to be about 1,000% higher than it would be if your GP veterinarian had taken care of it himself. But thanks to insurance companies and attorneys, those days are long gone. And even the way the students study today has changed dramatically. This is the way I learned cardiology: memorizing which chambers let blood in, memorizing which chambers pump blood out, memorizing which chambers and which arteries and veins carried blood or brought blood, oxygenated blood or deoxygenated blood. Basically boiled down to just a bunch of pictures and memorization work. And then you just had to kind of visualize it on your head how the dang thing actually worked. Today is much, much different, and I'm going to have to take you back in the house to show you how we study cardiology today. Okay, students, and here's how we study cardiology today. First off, you got to have your textbook, and just like everything else today, you got to have a computer too. So here we go. We're going to get started now. Okay, I hope this will come across, because we're going to have to run this from because we're going to have to run this through, because we're going to have to run it through an iPad and through this camera that we're watching. But this, as it says, if you can see that right there, says normal heart, and if you'll look right there's a QR code. And yeah, this is a lot better picture than anything we studied in school, and it's got all the numbers. But the way technology is today, we can make this thing come alive. First, you got to have the app, of course, and come on, man. There we go. Okay, you can tell it's the right app because the picture matches up. And we got to get a QR code off of that right there. And would you look at that? That picture just came to life, just like Harry Potter. So when you see that right there, that will really just tell you what a heart looks like when it's beating. Much better than just looking at a picture on a page and trying to figure out in your head how this dang thing works. But with the app, you can just turn that thing around and everything. And what's even more important than that is this. You can see this little button right here. We'll push it. Sorry about all the shaking. This thing is really sensitive. And when we do that, it opens up the heart. And you can see all those little red dots. That's the red blood cells. That's oxygenated blood. And all the blue dots over there, all the blue dots over there, that's the deoxygenated blood coming back from the body to go into the heart, to be pumped to the lungs, to become reoxygenated again. And to take this one step further, they show several different disease processes. Okay, and we will flip over here. This is a ventricular septal defect. And I hope you can see this. This little thing right here is a divider between the left ventricle and the right ventricle. And it's got a hole in it right here. And this is the oxygenated blood over here. And this is a high pressure chamber. This is a low pressure chamber over here that sends blood only up to the lungs. This sends blood all to the entire body. So this one, when you have this defect, it shoves blood through here into this chamber right here, oxygenated blood into the deoxygenated blood. And we'll be able to see that right here. Okay, again, there's the outside of the heart. And we're going to come over here and push this button right there. And we'll try to flip this thing up where we can see it. And now if you'll look right there where I showed you that hole was, right about there, you'll be able, if I can hold it, dang thing still, you'll be able to see oxygenating blood getting over into the chamber that's got deoxygenated blood in it. So from the left ventricular chamber over to the right side. And you have to go in there surgically, and you just close that hole right there, and then all the blood over here in the left ventricular chamber will go through the aorta to all the rest of the body like it's supposed to, instead of going over to the side that pumps to the lungs. So anyway, that's pretty cool. That's ventricular septal defect. And we'll also look at, this is mitral dysplasia. And most everyone knows what a mitral valve is. There's the heart right there. And we'll open it up. Okay, and this is our mitral valve right there. And as you can see, it's not closing off very well because there's red blood cells coming in from the top, and every time the heart contracts, they go back into the atrium. Those blood cells should be just like over here on this side of the heart. When they come into the atrium, they go straight into the lower chamber, the ventricle, and they stay there. But what's happening is that mitral valve is leaky, and it's allowing the blood to go to retrograde or go back into the atria. I really apologize for the shakiness. This thing is so sensitive. And those blood cells, they should be coming down here and then going right back up that chamber to go out of the body. So anyway, be a test on this in about 15 minutes. Class dismissed.
And you know, folks, in my heart, it's kind of a sad day, despite the fact that I know I'm leaving the veterinary profession in good hands. The new veterinarians are better educated than we were. They're better equipped than we were. They're more specialized than we were. And with 80% of them being women, the profession's a lot better looking than it used to be too. Well, folks, that's about it from out here on the ranch today. I didn't mean for this video to take such a somber turn, but honestly, what puts a smile on my face is I know all the young veterinarians, just like my daughter Allie, will carry the torch for us. They will put on the new mantle
and they will do us proud. So despite the fact that I'm bailing out on veterinary medicine, I'm proud to have been a veterinarian, and I know the profession will continue in a manner that we would all be happy with. Once again, thank you so much for taking time out of your busy day to stop by the ranch for a little visit. I always appreciate you being here. I love the comments you leave below, so please, if there's anything on your heart, put it down in the section. You know what to do. God bless you all. Thank you for being here, and I want you to always remember I love you. Bye-bye now.
So what you doing there, Al?
Neutering a dog, Dad.
All right. Who's gonna learn you?
That's a mistake.